We are doctors. This is part 4, the research and the publishing of the research. Research. Coffee's good, coffee's bad, coffee's good again, and round we go. How about the research on prevention of caries, decay in the teeth? We'll talk about that in a moment. Let's talk about that special issue that I mentioned in one of the previous videos, which was a special issue of the Journal of the American Dental Association, published in 2010, November. And the entire special issue was dedicated to the topic of cone beam technology and dentistry, sent to about 150,000 dentists, I understand, on the mailing list, which this cone beam at the time was a very new and very exciting technology then, and one that now many of us use and enjoy to the benefit of our patients. The issue followed and reported on an actual presentation that had been done at the meeting itself. And that particular meeting in 2010 had an open forum, and it was moderated, I understand, by Dr. Michael Glick, editor of the Journal of the ADA. And of the 4 panelists then, one was a founder of Imaging Sciences, selling CBCTs. Another was a consultant to the company's distributor, and a third was a paid speaker for another cone beam company. It was reported that the imaging scientist folks equated the radiation load of a CBCT with that of an airport scan. And in response, Dr. David Brenner, who happened to be the lead radiology researcher at Columbia University's Radiological Research Department, responded and said, in fact, cone beam scanners can be several hundred times as powerful as airport scan, and equating these is very wrong by a lot, he said. Well, of course, you're going to have things on both sides of the issues, and that's the whole point of looking at EBM and the research. Our interest is indeed the EBM to help us make great decisions and choices for our patients in our practice, which led me to research on the internet, do a search, and find out what they said the radiation load from a CBCT scan was, and it was reported to be 2 to 7 millirems, film-based X-ray 1 millirem, and an airport scan 1/100th of a millirem. So indeed, that showed us a disparity. That was interesting. One of the panelists from Imaging Scientists, Dr. Ma, had challenged the AAO's position that a CBCT is not required routinely for orthodontic radiography in diagnosis. That was also interesting. Certainly, we've used it for ectopic teeth and lots of wonderful things in orthodontics, but it was interesting to see the two sides there. So think of it. On one side of the issue were radiologists who were urging us to utilize our technology with caution and appropriateness rather than without any concerns at all. And that is, of course, what we want to do. On the other side of the issue were the corporate experts saying that this, and of course we would agree, certainly brilliant technology is safe and should be used widely, and why? Well, meanwhile, underwriting the entire JADA issue. Okay, questions. What would you think? Would you think that might be a great marketing strategy? Quite brilliant? Could the lucrative CBCT scanner industry be self-serving in this endeavor? Is that okay? And don't be too quick to judge. Hear me out. Think about it. We are examining the question of how do we know what to trust in our literature as regards our patients' safety. And we find articles on both sides of the topic. At the very least, it seems that we must read, certainly, on both sides of a topic. And research, if you can't find an article. Do remember Dr. Ioannidis saying that 70% or more of published studies are false. And as you question and answer your own questions, we must keep that in mind, because we are all human beings, including the researchers, the scientists. Here's more to question. When a company underwrites an issue or a study or a report in a trusted medical journal, what editorial control do they have in that? Is it possible that such a company, in addition to costs of the issue, would donate or pay organization officials, editors, and so forth to enhance the company's visibility, control advertising results from their donations, and financial results? May I remind you that the corporations are in business to make money, and so are we, right? And this is good. However, for us as healthcare doctors, we must view and perceive our ethical view, our ethical concerns, and how we make our money. And all of a sudden, we have to be looking at things from that perspective, because it's critical to the patient's well-being, to our own long-term well-being. Ethics are very important, and over the years, we've seen ethics lacking in various businesses and industries in our country, and looking at things with questions and discernment then becomes very critical. Yet, published literature can certainly help us to be the best for our patients. That's why EBM has become a popular and accepted basis for our practice. We're just looking at the important findings in some of these areas. Let's take caries, for example. Caries and its symptom, tooth decay, is interesting because to me it was incredibly notable to see Dr. Shiva's work on the fact that decay is related to an interplay of the sympathetic nervous system, yes, to the innate immune system, to the interferon system, and even to the adaptive immune system, as well as the microbiome, the virome, the actual microbiota in our body. That amazed me to understand the system interplay in something we see as acidogenic plaque and the resultant decay, making tooth decay then a bigger risk when these systems are reduced due to dysoxygenosis, not enough oxygen in the body. So in our concern for decay prevention, should we not be exemplary and flawless in our diagnosis of breathing issues, airway issues, as early as possible for our patients? Well, think about this too. We keep seeing how periodontitis patients, adults, are at much higher risk for systemic diseases, notably cardiac, and the chronics, diabetes, hypertension, and so forth. So actually, could correction of a child's airway, maybe expansion of the maxilla early on, change their entire future for the bearer hugely? And could it also reduce their risk of decay hugely? In consideration, how do we help the patient and parent in our sacred duty toward their health? That's really the question. We read published research. We read with discernment. Why discernment? Well, as to the question of editorial control, let me remind you, it has been reported that study findings of researchers that have been under grants to them and or their institution are published only if the grantors like the findings. They do have that control. And words to consider, of course, are marketability, audience reach, profitability. There are unspoken goals, and scientists, doctors, and professionals who do not agree may thus be shut down on either side. Keep that in mind. Look at what has happened with masks during our coronavirus times. Are they good? Are they preventing or are they harming? Are they being worn for days or weeks by unsuspecting public, drenched in moisture and microbes that potentially are much more virulent than the organisms that the folks want to prevent? Are they reducing our PO2? In considering Dr. Ioannidis's point, should we read all EBM with caution, even skepticism? I would say yes, of course. Should we look for the possibilities of what could be valid and important to us, such as understanding the interplay in decay? Yes, of course. Wouldn't that be a most honest approach to science? Not being strictly dogmatic to a scientific theory and excluding questions and analyses, a betrayal of our ethics. Wouldn't that be our intellectual honesty and the value of science betrayed? Dr. Rupert Sheldrake of Cambridge University, among others, has written extensively about this problem of beliefs that actually, think about this, impede scientific progress. Beliefs that can play in nicely with the corporate model of making money. Yet we value our literature, our growth, our new understandings, and our constant and never-ending improvement as doctors. Questions, discernment, because we are doctors. These things we must think about. In part 5, we'll take a look at how medicine has changed and use one specific area as a model for our questions. I look forward to sharing that with you soon.